Good afternoon, everyone. This is Arif Qureshi. I'm one of the managing principals at ICS. And thank you for joining us this Friday for COVID Convo. We kind of decided to put this together because there's a lot of interest from a lot of school districts around the fact that this is a constant changing situation. And I think learning from each other would be very, very valuable. When we did kind of decide to roll this up, we're pleasantly surprised. I think we've got close to almost 100 school districts signed up for each of these webinars. So clearly there is interest and hopefully we can get moving relatively fast on this. So if we can move to the quick agenda, I'll just take a few minutes to talk a little bit about ICS. As you know, we're a construction organization that works mainly with educational facilities to help create healthy, safe, engaging learning environments. With that, let me just maybe talk a little bit about a few resources. I've had a lot of questions since our last webinars in terms of some of the modifications and some of the things that school districts will need to do to ensure that you have a safe environment. We'll make sure that we load up this webinar also and the PowerPoint on the website so you can access this information. MMC is an organization out of Minneapolis, but they work throughout the state. They've actually put together a great resource guide for your facilities, and they can actually help you do turnkey projects if you need those. If you need any of that help, you can contact either Dana Fontaine directly or Brent Wavra, and we'll make sure you have that contact information. One of the reasons, again, we decided to do this COVID Convo was to make sure we get as many of your questions answered. So we've kind of put together not only school districts that are working through this specifically, but also some additional resources around public health, along with the co-op. And as most of you know, we've also retained Fred Nolan to help us through this process. He was the previous executive director at MREA. So with that, let me just start off by maybe having each of the school districts introduce themselves. We'll start off with Bemidji.
Thank you, and good afternoon. My name is Tim Lutz. I'm the superintendent of the Bemidji Area School District in northern Minnesota, representing the larger schools today. Thank you.
Thank you. Maura?
Good afternoon. I'm Dan Voce. I'm the superintendent at Mora Public Schools, and we're one of the medium-sized districts, along with, I'll let Brenda introduce herself.
I'm Brenda Spartz. I was formerly, and kind of still with Mora, curriculum director and principal, and now I will be superintendent in Nashwauk, Keewatin. So I was medium school, now kind of a small school.
Andy?
Good afternoon, everyone. My name is Andy Almos. I'm the superintendent of schools in East Central Public Schools, representing the small school situation.
Okay, great. Thank you. And then again, if you have any questions, we have the chat function. Please load those questions up on the chat function, and Erin will kind of make sure she summarizes all of those. And after we're done, we'll make sure that we answer as many of those questions as possible. So with that, maybe I'll pass it on. We'll talk a little bit about the Safe Learning Plan. I think most of you have seen this. You're well aware of the fact that there's a recommended policy guidelines that were developed by the state in terms of 14-day case rate range. And those are pretty specific in terms of how things have been set up. Again, districts are allowed to be a lot more stringent than these guidelines. But I do think one of the advantage of this is that we do have at least a data-driven process and a framework to work around. And you'll see as we go through each of these districts how they have to look at this data and make decisions in terms of which model of learning they're going to put together as they move forward. So with that, maybe we go to the next slide. And Fred, do you want to introduce them, or you want just the districts to kick off?
I think Tim can just kick this off.
Perfect. There you go, Tim. You're on.
All right. Thank you, guys. So in Bemidji, you can see our numbers there. We are kind of all over the place. We were doing quite well until right around the 4th of July, and then our numbers just spiked, and our community is concerned about that. And what concerns me about that is that not that I'm expecting to change our plans from week to week, but we seem to be trending in the wrong direction. Now, we had a bit of a dip. We're down from 21.03 to 16.26 per 10,000. But I've been hearing word from public health and from other sources that we're spiking again. So our numbers are probably going to go up and continue to go up and stay up for a while. And so one of the struggles that we have in this area is we're still not quite settled on what our base plan should be. To give you an example, last week when the governor had made his announcement, our numbers were floating around that 14 mark. So we thought we were all going to be looking good, elementary in school, and a hybrid for the secondary. And then one day later, our new numbers came out and they were over 21. And now they're down to 16. I have a couple school board members who are leaning towards moving the dial to a more restrictive setting and doing distance learning because they're anticipating the numbers are going to continue to go up, and they don't want us changing very often. They want us to start with that very restrictive. Some of my principals and I are leaning more towards wanting at least our elementary students in school, because I can't imagine teaching kindergartners who have never met their teachers. So we're at a point where we're going to have to wait at least another week. We're going to be conferring some more with our public health specialists and with Sanford Health Systems here in town, and hopefully we can have some consultation with the Minnesota Department of Health, which was recommended during the conference call yesterday. But those are our numbers. If you want to move on to the next slide, Aaron, I can talk a little bit about where we're at with our planning. A lot of our families and teachers are trying to make their own plans. And they can't do that unless they understand what our 3 scenarios look like. So we have made sure that we've put our scenarios onto our website. We have a bare bones website right now, but we have all of our scenarios, and we have an FAQ site, and we'll be adding more information as it comes along and as we get that. But as people are trying to plan, especially if they have students with underlying conditions or students on IEPs, they need to be able to understand what each of our scenarios will look like for them, especially the hybrid model. And for us, it's a week A and a week B model, so that they can begin making their plans. So we have posted those on our website. And then if you move on to the next slide, Aaron, I think I can point out our distance learning option. In Bemidji, we're like any other bell curve. We have quite a few people on one end of the spectrum or the other. A lot of people think this is still a big hoax. I get a lot of emails every day saying, wash your hands and let's get over with it. And let's get into school. This is ridiculous. Masks don't do anything, that kind of concept or that kind of thinking. And a tremendously large number of people who are questioning, who are anxious about sending their children to school. So we are really promoting and making sure parents understand that regardless of our plan, they have that option to go into a distance learning full time. And so we created an online, what we call a distance learning opt-in form, and you can see it there. It's very short and simple. It asks for some demographic information and allows people to let us know through a Google form like that that they want to opt into distance learning. One of the questions that comes up is, how long do we have to stick with this plan? Do we have to wait until the end of the quarter? Some schools are doing that. We're asking for 5 days notice, that's all. So if a family wants to either opt into distance learning or back out and come back into the hybrid model or whatever model we're running, they can do so within 5 days. It'll take us a few days, we figure, to get things set up. Also hearing a lot of concerns from teachers, and they're just not quite sure what they can expect either, and that's understandable. We are trying to reassure them and give them confidence that health and safety are our priorities. The last thing I'd like to mention is that with our numbers spiking, we sent out a press release as a school district last week I posted it out to the media on Friday because most of the people in this district, they want kids in school. And so do we, but we have to do it safely. So we are asking our residents to take the CDC guidelines and the MDH guidelines seriously with hygiene, social distancing, and wearing of masks, so that we as a community can get our numbers down, so that we can get to the point where we can get our students in school, at least the elementary students. And that's a brief summary of Bemidji. Thank you.
All right, I can speak a little bit to Mora Public Schools. I don't know if you're going to show our numbers or not. But at Mora Public Schools, we've been working really hard with our staff and Kanabec County Health and our parents and families, just keeping them up to date. Currently, our rates are around 3. And so relatively speaking, that would put us in the in-person model. There they are, 3.12. And we've met with Kanabec County Health on a regular basis. In fact, yesterday we just had a meeting with them, and they are keeping a daily track of where our COVID numbers are. And so they have the most up-to-date information. So we found it really helpful to have that weekly meeting with them, and they could tell us that actually we're more like 5 right now. And so we're still under that threshold. And I did invite them to our school board meeting. We're planning on having a school board meeting to adopt a resolution to accept our plan and to give an update on where Kanabec County Health is currently at this time. As Tim mentioned, we're trying to do a lot of different things in order to make sure that families know they have some options and choice, and whatever their comfort level is, we're going to provide those options. I don't know, maybe Brenda, you could speak a little bit more. Brenda worked closely with our school teams in order to put our plan together.
Well, one thing is when we looked at the July 30th, and I looked at what we had already developed and, you know, spent a lot of time doing. But when I looked at it, there was kind of a misalignment between the 3 models and then trying to think about moving from one step to the next to the next. So what we did in Mora, we just named the steps, phase 1 through phase 5. So phase 1 is all in person. Phase 2 is when the ranges change, and then exactly what's the ramifications for phase 2 when elementary is all in and secondary goes hybrid? How does that affect transportation and distance learning and meals being delivered home? And there's all kinds of ramifications and different things that go with each phase. So we named them more phase 1 through phase 5. And then looking at that, then we decided when you move from some of these phases, like phase 1 to phase 2, when secondary becomes hybrid, and all of a sudden, like on the bus, we have to strictly go with 6 feet of distancing, but yet elementary is still in that in-person creating space, but maybe not strictly 6 feet. What are the ramifications for that on transportation? Well, we quickly realized that when we transitioned from phase 1 to phase 2, then we couldn't do transportation, all kids on the bus. So what we decided to do is we decided to set ourselves up from the rate of 0 to be able to react clear through all of these phases without very much loss of how we're doing things. So very smooth transitions is what we wanted. So we went ahead, and even in person, we staggered our start to allow for that transportation. And when we transition from a 9.9 to a 10, high school goes hybrid, it's seamless. So we tried to set ourselves up for seamless transitions for our families to be able to plan, staff to be able to plan. So some of our documents, if you've been on here with us the first time, you'll go on and you'll see a lot of changes due to some of those things. But yeah, it's been a lot of work the last week, but I think we've really set ourselves up for success in being able to start, have quick transitions, have quick reactions, and kind of maintain continuity throughout. So yeah, it was surprising when Minnesota came out with the model. We thought we were all in hybrid, just like the rest of you. Just made some assumptions, and boy, we should not have. We're very, very glad that, especially, just like Tim said, kindergarten. I want kindergartners to be able to come and meet their teachers and set those relationships. So really happy that we get the chance to do that.
I can jump in and give you an update from East Central schools. Our most recent data shows us at 3.43 cases per 10,000. So we, and when this came out, we were at 2.75. So we've announced to our families and our community that we will, assuming the numbers stay as they are, we will be opening in person full time, as relatively normal as possible, and more like the new normal, of course. I think the challenge that all of our districts have with the plan that's come out from MD and the governor's office is, we were planning for 3 models, but really it's more like 5 or 6. And so we have to go back and say, like, as Brenda said, what is the transition between those models, and do we have a plan? So our current process is to kind of build those structures in place. What's going to happen if, and be ready to go for that. Be ready to issue communications to families in a timely manner. That's a big thing. We are seeing some of the same concerns as the other districts. Some of the staff concerns, staff on both sides of the issue. Some that are really struggling with even coming back. The idea of their own anxieties and their own fears. So they're asking questions about what kind of structures and personal protective equipment we're going to have for them. So with our staff on that side of it is, a lot of it is just dispelling rumors, trying to provide some reassurance that things are going to be okay. And of course, we have the other side of the coin as well, where some staff are really dismissive of this and are really wondering how masks are going to work with kids at school. And I mean, that's a valid question, but we all have to kind of find that middle ground and make this work for everybody. Our parents, we've had a small group of people that have notified us that they intend to homeschool. So far, those families are ones with kids with medical concerns, so legitimate things. We've established a partnership with Pine County Health, and that's been really beneficial for us because they're helping us insert some language into our plans, helping us with the response plan. I included this slide as well because they took the different learning scenarios and actually equated it to what would the positive tests, how many positive tests does that really mean for our county? And this has really helped us be able to communicate with families and with staff. Because when we fall into that in-person learning for all students, what does that really mean? Well, that means basically up to 29 cases in the county. We also have prison systems in our county. So one of the things public health is really examining and will help us do is if we do have a spike in cases, where are those cases? And do we really need to shift models if it's in the long-term care facilities, if it's in the prison systems, what does that look like? And so we've established weekly meetings with them to review. We've put them on Thursday afternoons, so hopefully we have the newest data to look at before we meet with public health. And the planning continues. I think one of the biggest challenges that we have, and probably all districts have, is the distance learning option for families that choose not to send their kids to school. You have to be able to scale that planning based on what model the majority of your kids are in. So, if we take the 3 scenarios that we planned out per the governor's first request, the distance learning option is really the distance learning option for all kids. But if you plan a distance learning scenario for only a small number, your staffing levels change. So we're currently working on how are we able to scale this up and scale this down if we have to move throughout the scenarios. So we're really on to what does distance learning like for the parents that opt out of the in-person scenario or potentially opt out of the hybrid scenario. And it's definitely a challenge, but that's our next task. With distance learning, hotspots, our principals have been around the district carrying hotspots with them to try to find those connections in those spots where we just really do not have any or very limited broadband. So they've made the tour and looked around, and so we think we have sort of those spots identified, and we need to work with the families in that area. Staff and student expectations for distance learning. What does it mean if the parents say I'm opting my kid into distance learning? What does that really mean for them? And how what's expected of the student, what's expected of the staff member, and what's expected of the parents? Those registration deadlines. We believe as a district it's best to have our kids in the building if that works for us. So we would let our families kind of come and go through our distance learning option. That might be the benefit of a smaller school. To be able to let them do that. But if it doesn't work for them, we want them back. So we wouldn't hold them to a timeline. We'd let them kind of come back to us if they choose to. And of course, the technology needs, that kind of ties back to broadband, but are they able to access what we'd like them to with distance learning? And of course, we need some professional development for our staff and be ready for that come September 8th. As far as staffing goes, once the governor's announcement came out, we did have 2 resignations. So we are going to scramble and try to fill some positions. The staff concerns have come up, as I mentioned. But overall, the theme with our staff is we will get you the personal protective equipment that you think you need. And if that's a change in space, if that's something for them to wear or something to protect the kids, that's the theme that we are putting out to our staff. Working on our staff workshop schedule. Workshop's going to look different than it ever has. And when we met with our administrative team, I told them, I said, I think the theme is get them in the building and get them ready to work with kids. And we can make the rest, those things that you have to do every year, bloodborne pathogens and those kind of things, it's going to look different this year. Open house, changes to open house. We're going to limit the number of people that come in here prior to school starting. And of course, we all know with the Minnesota State High School League moving fall sports to the spring, what does that mean for us? What does that mean for our kids? What will our kids do for extracurriculars? And so those are discussions we're having now. And of course, PPE distribution. That information or those things are coming from the state now, but how are we going to get that to everybody? So we're working through that planning as well. And that kind of wraps it up so far. There's a lot to talk about prior to school starting.
Wonderful, all 3 of you. We've got 2 questions already come in, and so anyone can take charge of this one. Is there any discussion about keeping students in pods or in without moving around? So if a case is identified within the pod, those students will be quarantined for the entire school. So both in the in-person and the hybrid model from Bemidji, have you thought about that?
Yes, we have, and that is what we are doing. For one thing, it's an easy process in our middle school, which is already based on the pod system. And our 4th and 5th grade Gene Dillon Elementary School has houses. And instead of calling them pods, but it's the same concept. And we are designing that to work along those houses or pods. But in all of our other buildings, our elementaries that are K-3, as well as our high school, we are designing it in a pod system. And as much as possible, we are keeping students in their classrooms. And when we can, we'll have teachers do the moving between to keep students in the classrooms as much as possible, not acting as vectors in the hallways or anywhere else.
Okay. Andy or Dan?
I would echo that response. Our building is actually designed, we don't call it pods, but it's actually really designed that way with a breakout area for each grade level in the elementary. And there's these kind of breakout areas up in the middle school and the high school as well. So our building just physically lends itself to that. Just the changes of moving kids between teachers, we wouldn't be moving the kids as much, but rather we'd move the staff members.
Okay.
Yeah, I think for our elementary, it's set up. It's a fairly new building, so that'll be pretty easy. Our high school is not set up well to organize by pods, so we're going to have to do some creative planning to maybe do some staggered release times or whatever for classes. We did move to more of a block schedule instead of having 7 periods in one day, we're going to have 4 one day and 4 the next. So those are some initial ideas, and then we'll dig down in the details a little bit more.
Okay. Barnesville is asking, they're planning on doing in-person 4 days a week, but then doing everyone distance learning 1 day a week. They're saying Friday, primarily to give teachers chances to record flipped lectures and flipped classrooms so that the distance learning can continue the next week. So I think, Andy, you talked about the need to scale up your distance learning to the amount of students that are in distance learning. And so can you all kind of talk about how you're trying to address the distance learning component, and what do you think about the idea of maybe having not 5 days a week in person, but 4?
I have some thoughts on that. Because we're doing a staggered transportation, so elementary is coming first, an hour later high school is going to go. Teachers will have 90 minutes in the morning if you're a high school teacher, 90 minutes in the afternoon if you're an elementary teacher, because they're also going to be needing to interact with families who are distance learning, who are either, if it's an A day, they're going to have to check in on the B kids. And so we're just trying to build in more time for teachers. As well as in the high school, we're 7-period high school on 1 day. Even from the start, in person, we're going to be doing an 8-period over 2 days for high schools, so that if we go in person to hybrid, there's no disruption in the scheduling. And then that 8th period is going to be an advisory period that we're adding. And as well as we're going to build in a prep time with a longer block now. I think it's 110 minutes for high school teachers, because they're going to have some extra time for servicing distance learning kids. And so we just wanted to make sure we built those structures into, especially our high school, because at the elementary, we have 1 teacher per grade designated distance learning teaching. So it's not as big of a problem at the elementary, but the high school, we had to allow the teachers enough time to do that.
Okay.
We, in East Central, we actually, for quite a few years, have had early dismissals on Wednesdays. And that has been focused on professional learning communities. But this year we would be pivoting that pretty abruptly to give more time for staff to prepare for that. So kind of what they need, the professional development to support those distance learners. So our whole PLC schedule will be different this year with that in mind. It also gives us the opportunity, I should have said this earlier, but when we're working with Pine County Public Health, they have raised the concern that by the time we hit the thresholds set by the Safe Learning Plan, they're worried that we're going to be a little too far gone to kind of get ahead of this. So as we watch those numbers, I think there's moves for us to make as far as a 4-day-a-week in person and Wednesdays in distance learning. So there is a chance we may include that in our model as a move prior to shifting to different models if we start to see a spike in cases.
And in Bemidji, we're doing many of the same things, except we are not doing anything where we split the week up with a day or part of a day that's geared towards distance learning or geared towards prep time, but we are actually developing a distance learning team, a little bit like a curriculum committee or team would look like. And many of the members of that distance learning committee or team will be the staff members who have underlying conditions, who are not feeling safe or comfortable being in our buildings. And so they will design the distance learning planning and programs and curriculum and delivery system. And we're trying to have a teacher from every grade level, at least up through the middle school. It'll look a little different with the high school. And those are the teachers who will be providing that delivery and also providing support and consultation to some of our classroom teachers, who may also then have to do some distance learning to students if we move to a full-time model as a district. Something else we've done to help with some staff development and some prep time is we've adjusted our master calendar. We've taken a day from the end of the year in June, one of those worthless, useless days, if you will, pretty much designed to close things up. We move that to the front of the year so that we can include that as an extra time period for teachers during back to school week to prepare and to plan and get things ready.
Okay. Well, that's all great stuff. And we do have some questions on special ed and early childhood. But before we get into that, I want to bring on two more people here that are on the panel. One, we're happy to have Jeremy Kovash, the Executive Director of Lakes Area Service Co-op. They have a more important role in this than was imagined prior. So Jeremy, why don't you introduce yourself, a little bit about the role of service co-ops, and kind of respond to what you've heard so far from these three school superintendents. Jeremy, you might have to unmute yourself. I can't see you.
There you go.
There we go. Good?
Yep.
Okay, thank you. Jeremy Kovash, Executive Director, Lakes Country Service Cooperative. Looks like maybe I can do video too, but I'm on my phone. I'll just talk. We learned yesterday from the governor's office, and the governor, his office also was on with you. Stephanie Graff is coordinating the efforts of the regional response teams from the governor's office. Those regional response teams will be made up of 4 members, 1 representative from the service cooperative or perhaps a team, a health, a testing coordinator. And what that means is if there's an outbreak in Bemidji or a classroom that gets affected, that coordinator will work with local public health, local providers to determine what level of testing is needed by each school district and what level of testing is needed in each community. And then 2 epidemiologists assigned by the Department of Health. And so those epidemiologists will essentially be the 2 supports for school districts as you determine your hybrid or distance learning models and what level of flexibility you'd like to have. As has been mentioned on the call, the local public health officials will work closely with that team. So your county public health officials, many of you are already reaching out to them, and I would highly encourage that because as you heard yesterday, these regional response teams will not really be up and running until the 24th and 25th of August. I know some of you start school prior to that. So that's kind of what we know. The service cooperatives will try to help. And I do see the question, thank you. The service cooperatives will try to help you in each of the regions. Again, the regional response team will be 1 representative of the service cooperative, and in our case in Lakes Country, it'll be me. I think in Southwest, West Central Service Cooperative, it's Shelley Mays for those of you that know Shelley. And then I think each cooperative is trying to identify their representative there. That 1 person from the service cooperative will kind of be the facilitator, I think, of discussions between the school district and regional, local, and state officials. So the other 3 members beyond the service cooperative would be 1 testing director of testing, or testing coordinator. So that person, as assigned by the Department of Health, will help your school district regarding testing issues regarding COVID. And again, what level of testing, who needs to be tested, how are they tested, how do we pull that off? And then 2 epidemiologists as assigned from the Department of Health. So those are the 4 members of each of the regional cooperatives. In talking with Stephanie Graff yesterday, the governor's office, she is working on a flow chart and organizational chart and some of those kind of things. The additional resources for that team to support you may be additional representatives from the cooperative, your service cooperative, and it would probably also be those county health folks. So my understanding, and this is mine, so you can't quote this, is if there was an outbreak in Parker's Prairie, Minnesota, which is in our region in Otter Tail County, or if those numbers started to spike up as you're all tracking those numbers, first of all, the county and local public health folks will have more accurate and up-to-date data than you see on the release every Thursday, which is really 2 weeks old. That is due to HIPAA and those kind of concerns for the public. But the local and county public health people will have much more accurate and pinpointed data as far as those outbreaks and positive tests. We would probably, if this happened in Parker's Prairie or Otter Tail County as an example, my understanding is I would call a meeting of Otter Tail County Public Health, our 2 epidemiologists and the testing coordinator. We would communicate then with the superintendents of our school districts. We would determine where the threats are or the rise in cases are, and we would try to act accordingly with guidance, again, from the Department of Health. And primarily, I think those 2 epidemiologists are going to be the ones that kind of you work with as your resources to determine what level of hybrid, distance, or open learning that you might have. So with that, I'll stop. I can help with any questions. Fred, that's just an introduction. I will try to be on all these calls. Arif, thank you for the invite, Arif and Fred, and I will try to be on all these calls as a kind of a reference point for those regional response teams weekly.
Thanks, Jeremy. And that's a great role for the service co-ops. And many of us know Stephanie Graff from her time at MDE. So she's quite a go-getter. And so I think that's a good call. We also have from the University of Minnesota, Dr. Neil Carlson, who has been working on the health side of this. And Neil, I'd like you to introduce yourself and do 2 things. 1, respond kind of to what you've heard so far. And secondly, I have a question specifically for you in chat about the value of negative COVID tests. So why don't you respond first, and then I'll read you that question.
Well, first off, I have a master's. I'd like a doctor, but I haven't got to that point yet. Second, I really like the creativity that each district has employed to try to maximize their skill sets and make allowances for appropriate teaching from distance learning. And we're applying that at the university a lot. We're moving more and more toward doing more distance learning as we come in the fall. I think primarily because we've got people coming from all over the world. One of the other questions that was asked was about pods. And I think we're having students self-aggregate into small pods so they can minimize the risk. And I think that's going to be really helpful. And you can think about talking with your students saying, we want you to have a smaller group of friends that you hang out with and not bounce around with a lot of people. We just had a place where we had to shut down a lab because 3 people went out to eat together. So I think that's important. And then the next question you had?
So I'd like to just reinforce what you just said about enlisting the kids. I mean, we're to teach them hand washing and hygiene, but I think you can actually enlist them almost like a responsive classroom, that they're responsible for themselves and they can be active agents in preventing the spread. And I think that's great advice. The question has to do with if you have a positive case in your school with a teacher coming back from quarantine, are you going to require a negative COVID-19 test before they come back? And that sort of gets to the more general question of the value of a negative test in and of itself.
Yeah, there's some problems with some false negatives, and Mike Ostrom has talked about it, and it's a fairly high false negative rate. I can speak from experience, and then my cousin tested negative twice before finally testing positive. So I think with respect to it, with returning, they've got some specific guidelines from the health department and the CDC indicating that you're essentially symptom free and you've passed it. And I think the availability of testing will become more prevalent at the university. We're looking seriously at doing a lot of saliva testing and doing that at a fairly high frequency. And that may be something that if it becomes more widely available, some school districts, particularly in areas where they're kind of on the border on doing between hybrid and shutting down, they may want to also take a look at that as well.
Okay, good advice. We're going to back up a little bit, gentlemen, and Brenda, and ask about special education and early learning. That question came in earlier. Those are Voce special populations with different rules, and MDH has just come out with guidelines for close contact with high need special education students. I think that's must reading for every district's special education leadership and staff. But how are you responding, Andy and Dan and Tim, to early learning and special education? Who wants to go first?
I could try. So early childhood, preschool, we're planning on having those students back, 3 and 4 year olds. And then if we have to change to a hybrid model, we might have to do just 4 year olds. So we have a early childhood through our community ed coordinator who's worked, and that's part of our plans. So if anybody needs to look at that, let Brenda or myself know. And for special education, we're fortunate, as I'm sure the other school districts around the state, many of them belong to a service cooperative. So actually they will, I think next week, be going through the guidance and creating those special education plans. From our district standpoint, we're working on the PPE plan and trying to educate all of our special ed teachers on what they need to do to stay compliant.
And I can add a little bit to that here in Bemidji. We're doing what Dan said when it comes to special education. We have a very high percentage, over 20% in Bemidji. So we're working hard to figure out ways that we can respond best to every student's IEP plan and what we need to do for them. We're also working on ways that if we are in a hybrid model situation, or even perhaps distance learning, where we can at times provide some additional supports and allow small groups of students to come into the building. We have not determined that yet, whether or not we have the capacity to do that, but we are exploring that. I had a good conversation with our early learning people just this morning, and we have an interesting situation where we have all of our students in one building. It's our Paul Bunyan Early Childhood Center. And because our numbers are down and because we have a lot of space, we're finding out that even in a hybrid model scenario where all of our elementaries, let's say, and high school students might be on the every other A-B schedule, because our numbers fall in line, we would still have enough space for all of our 4-year-olds. So we are thinking that even if we have to be in a hybrid model, we might explore the idea of having kids be in the building every day, because we can maintain that social and physical distancing and allow that to happen for those 4-year-olds. We're not sure yet if it'll work, but we're going to give that a try so we can service the needs of our youngest learners in that fashion.
And for East Central, very similar. Our preschoolers are planning to come every day. Our 4-year-olds, I should say, actually, they come to school 4 full days a week. So Wednesdays is off for them. So there is a break in the middle of the week. We will probably be making physical changes to how they enter the building. You know, drop off will be at a different door closer to their space, try to separate them as much as possible, you know, similar to what we're doing with all grades. As far as special ed goes, like Dan said, you know, members of our special ed cooperative, SCRED, they're providing some really nice guidance for what we should do with our, you know, our highest needs kids. Our case managers are in the process of connecting with each family to talk through what this means for the health of the child, especially those that are high risk. We're talking with some of them about increasing special transportation for those that you know, should not be with other kids or other adults on the bus, separate entrances for them to come in, a little bit more isolated time with a case manager or with staff in the building. So we're really just working through that on a case-by-case basis. And within the IEP for special ed kids, we're putting all 3 scenarios and what we will do for each kid within their IEP, so we can shift between models without having to call additional meetings to, you know, really go through that heavy lift each time we have to switch.
Okay, this all seems real practical. We also have another person on the call, I believe, Todd Rapp, who is a communication specialist. And Todd, you've been listening to this conversation, I believe. What do you want to comment about the communication you've heard from these districts, and what do you recommend going forward?
Well, first of all, this is the first I've heard from all 3 superintendents, and I'm very, very impressed with the focus that you put on not just informing your communities about what's happening right now, but also sharing with them what else could happen down the road and the process you're going to go through to make those decisions. I think right now, the biggest concern out there in your communities is there's a lack of understanding, and they obviously are turning to the school districts for that information. If they can't get the information easily, they'll be listening to what friends and neighbors and other people who may be well-intentioned, but frankly just aren't as knowledgeable about the plans, what they'll be saying. Then all of a sudden you're playing catch up. So that would be the number one thing I would say. The second thing I would say is that you're going to be getting additional guidance as time goes on from the two departments, and some of that guidance will be about communications, and it'll be important for you to stay on top of that. We will get something out to participants in this format in these Friday meetings we're having. We'll get something out hopefully as early as Monday, a checklist for you on communications. What I don't want any superintendent to do is to get so worried about the communication side of things that they all of a sudden they're taking their attention away from the educational needs or their support for staff or their ability to deal with student problems as they come up. So we're going to try to get to you a few things that make it really easy for you to know what it is you need to do, and to, on a week-to-week basis, just kind of follow along and literally a checklist so you know whether or not you're completing all the expectations that the departments are giving you. The final comment I would make about all of this is that I think it can be really, really hard to share detailed information about the epidemiology here and the questions about transmission and so on. It's, we've got some experts, and Neil and others have stepped up to help. But really, develop that partnership with your local public health as quickly as possible. Get your regional cooperatives in the loop on that as quickly as you can. You're going to need some help from third parties to stand up for the decisions that you make and to explain the health reasons behind that. You're the education experts. You've got access to good health experts. Lean on them and trust them to help you with the communication you're going to need to do. This is a long road. I keep reading about the idea of a fall and early winter wave that's going to knock us a little bit off our game. And I think the more that we're able to work in this team format, the better we'll do. So that's the summary based on what I've heard. I think from the superintendents who are on right now, you've been doing a terrific job. Keep it up.
Thanks, Todd. Before we go to our last question about what are you going to be looking forward to this coming week to get accomplished, I don't see any other questions coming in. So if people are our attendees, please put your questions into the chat. I would like to ask you, obviously, staff self-identifying with medical conditions or a household member with medical conditions is incredibly important in this process. So if you could each describe what is your process, how are you having staff self-identify? Are you asking for any sort of documentation through your ADA process or your contract language? How are you working through this? So whoever would like to start on that.
I can start. I can jump in on that. I think it's, given our size, this might be an advantage for a smaller school just with the limited numbers of people. But we've taken a real basic approach, and we've told our staff, if you have concerns about yourself or your those that live with you or those that you come in contact with regularly, we need to know those things. We need to talk about those things. Obviously, we're not going to ask for any information that's private or things like that. But if there's things in their life that are going to affect their ability to help us as an employee, then we want to talk that through with them. And, kind of utilize those relationships we have with our staff, and that's working through our principals, because our principals have those boots on the ground relationships. And then we've been able to work through that with those staff members so far. if it had to, escalate to disclosure and some of those other things, we would go there. But right now we seem to be managing it well based on those relationships.
Okay.
I could speak a little bit more about that. It's pretty similar to what Andy said. We did, as part of our staff survey, try to ask people who are not comfortable or might not be able to come to work. And then we've also sent out an email just letting them know that they have to self-report. And I believe there was a form that was attached to that was probably used by many districts in the spring. And then we're going to work through those individually. I did meet with our union reps to just talk a little bit more about what that process might look like and how we're going to try to accommodate as many people as we can, but yet be able to educate our students at the same time. So there's a lot of questions left and a lot of work to do yet on that side of things.
And in Bemidji, we've done much the same thing, although we have just shy of 400 teachers and a little over 280 some paraprofessionals. And we did send out a survey first a couple of weeks ago, just so we can get a feel ahead of time for the kinds of numbers we might expect in terms of responses regarding underlying conditions or vulnerabilities of that nature. And then shortly after that, we sent out some instructions informing our staff about how to go about informing us. And we are requesting doctor's notes because we have so many staff members. We can't just work with people who feel like they're vulnerable or feel they live with someone who is vulnerable. We are asking for documentation from healthcare officials so that we can sort through that and do it in a way that's fair for everybody.
Okay, that makes sense. Neil, would you like to say something there?
Yeah, we run those scenarios through our Office of Disability Services, and I don't know if schools have something similar on that. But it's nice to have at least some people or someone that's a confidential bridge between the information that's coming from the doctor and then the information that goes out to the school. For instance, when we had our outbreak, we just listed as student 1, 2, 3, and 4 rather than list the people's names. And I think that's a good way of being confident. The other piece that some of the staff members may have is they may have a spouse or child who is extremely vulnerable. And when they go to school, they're really worried about picking something up and bringing it back home. And we've made some accommodations with respect to getting extra PPE for the person who chooses to go into school and do that. But those are some of the interesting accommodations that we're working on.
Great. Well, the last question we have on the chat before we go to what are you going to do next week is what are you doing about what are your plans for like the daily screening or the daily health questions for students and staff entering the buildings? Real quickly, do you have things set yet, or is that still something you're working on?
In Bemidji, we're still working on that. We're trying to figure out a system that we can use for electronic questioning and answering that parents can be involved in so that they can let us know every day that they have screened their children and they're ready for school.
We've chatted with public health about that exact question. And there's a varying opinion even in the county school districts, but for our school district, we intend to scale that up if cases rise. But right now we're not planning to screen like everybody at the door. Our staff members, of course, would be, we have that notification to tell them if you have these symptoms, you need to stay home from work, those things. In our elementary school and in our first hour classes in the high school, we'll have some screening questions for the kids, kind of like we've done for, athletic practices and things like that. If you're having these symptoms, you need to disclose that, tell us. In our elementary school, with an in-person model, we've asked our staff, elementary teachers are great about seeing if the kids are not feeling well, how they're acting, how they're behaving, how they look. Kids in those situations then of course would be escorted to the nurse's office and be assessed.
Okay.
Yeah, pretty similar in Mora too. We're working with Convo County Health, and they They have suggested we ask the screening questions on the CDC and Minnesota Department of Health and do a big education and communication to all parents and students and staff on how to check on a regular basis. We did talk about trying to figure out if parents had thermometers at home so they could be taking their temperatures. So that might be a question in our next survey. And if we have to try to help with that, we're gonna maybe try to do that.
All right. So quick follow-up on the staffing question. The questioner is wondering if staff do not self-identify, are you simply expecting them to come to school, especially the in-person models in East Central and Mora, or are you going to give them the choice of working or telecommunicating? In other words, if they don't self-identify, are you simply expecting them to they'll be there and they'll be teaching the in-person model?
If I understand the question correctly, if they self-identify as being sick or they're sick, in my opinion, then that would be a sick day. They would be off work for the day. So we would not require them to be teaching remotely or something like that.
Okay.
Yeah, I don't. The question, I think, I'm not sure if I fully understand too. Like, if somebody doesn't self-identify, are they expected to come to work in an in-person type of setting? And yes, I mean, if we don't know about their condition and they don't self-report, then we would expect that they would be teaching unless they bring something to us, and then we'd try to accommodate as best we could.
Excellent. Okay.
I think the question is, if we have a distance learning model going, are teachers going to be required to come in and sit in their classrooms, or can they work from home?
Oh, it says full district. I see. It probably means full distance learning. You're right, Brenda. Okay.
That's the question.
Yeah.
I don't have an answer, but I think that's the question.
We don't have an answer. Yeah, sorry. Okay. All right. Well, I think, go ahead.
Well, just my quick answer to that is, in a full distance learning model, we would be allowing our teachers to work from home, but we're actually working on expectations for them should we need it. What does it mean to work from home? So we clarify that for our staff. But and the reality is, if we need distance learning, we need to get less people in our school building, so they would be allowed to work from home.
Okay, good. Thanks, Brenda, and thank you, Nikki, for getting that organized. Well, we're just about out of time, so I'd like to start with Tim and go to Dan, and then Andy, and then finally wrap up with Arif. But the three of you and Brenda, what's on your to-do list for next week? What do you really want to get accomplished now that we're 1 week closer to the opening of school?
Well, in Bemidji, I can't wait to have Mr. Todd Rapp come up and visit with us on Monday. He's coming up to work with some referendum stuff, and I'm going to pick his brain some more about communicating with the public. And that's one of the things I'm hoping to do. Our team is hoping to do in Bemidji is to analyze our numbers some more, to work with public health some more, and to get the word out a bit more about the details of our plans. We have our broad strokes presented. People can read about our scenarios, but now we need to answer those other questions that constantly come up. When you provide one answer, you develop 5 questions. What does this look like? How does this apply in this situation or in that situation? What does it look like? A lot of our teachers are asking questions right now, and we have to make sure that we answer those questions for them and for parents, and that we keep getting the information out there. So that's our goal for next week.
Okay. Dan?
Sure. There's a long list of things that are on my mind, but specifically next week, we have a special school board meeting on the 12th, which Brenda and I will reveal all the different parts of our plan, return to school plan. And once the school board approves that, hopefully, then we'll make a recommendation based on the numbers. And then we're going to communicate that out to parents as much and as often as possible. And so those will be the 2 big pieces, and with our staff and our community. So those are the 3 big pieces that we have for next week.
And from my realm, I am finishing up all those details. We did have our framework, and if you were on this call the first time, a lot of you wanted our documentation, but we didn't have the details there. We are finishing up all of those different realms of responsibility, if you will, and the details and coordinating all that. So all of that should be finished Monday. That's my goal. So that's what I'll be working on.
Okay, and Andy?
In East Central, three things. I would echo the sentiments of the others, but three things. We need to put the finishing touches on our distance learning model for those families that choose that model, and make sure it's communicated. I will be stealing some of the information from the other superintendents on this call, because there's some great stuff there. Workshop schedule. We want to finalize workshop schedule this week and get it out to staff so they know what to expect. And of course, to communicate the welcome back to all staff, and try to put some minds at ease with our staff and with our families, setting some benchmarks too for what does the next month look like with communications, so that they know when they're going to hear from me.
Great, great. And Scott will put that question to our panelists in writing, and you can check the FAQ on the ICS website for that. It's a great question, but we're out of time. Arif, you want to wrap us up here?
I will, Fred. So first of all, thank you to the panelists. I think that's extremely helpful to have all of you involved in this. I know it's a time out of your busy schedules to do that, but I think it's a valuable service to a lot of the other districts that are on there. The other thing I'll just mention is that we are going to have these on a regular basis every Friday, and we will have not only the school district panelists, but we will make sure, Jeremy Kovash will be there from the co-op, because this will, again, as I mentioned when I started off, things will continue to change. So we'll have those people on too. We'll have Neil Carlson on the public health side and Todd Rapp. So the intent is to really be a resource for all of you as we move through this challenging time. And I'm positive, that the plans we put in place, and it'll be an exciting time to open up schools, but we'll have to be ready and flexible as we move forward, because I think we don't know where this virus is going, how it's going to come through, and what changes are coming from the state too. So that's really my final question. Again, thank you very much for the panelists for your time.
Thank you all. Yep.
Thank you guys. Take care. Bye.
Thank you all. Bye-bye.